Correct. Well, and part of that, I mean, the credit to that would go to Dr. Paul Pepe. He was the first MD medical director full-time for the HFD. Prior to that, you had tangential relationships with physicians who were familiar with it, but they didn't do what Dr. Pepe did. Dr. Pepe came in here, and he's full-time. He is focused, and not only was he focused on providing better care, he was focused on the individual paramedics. Every one of those paramedics under Dr. Pepe was given the opportunity to certify through him for what was called Plan A. And that was basically standing orders that that paramedic was allowed to run a cardiac arrest situation without calling in to the base medical station and do what they knew, what Dr. Pepe perceived out of each paramedic, that this guy knows what he's doing, and it was his license on the line, and so he had to give his approval, and he wouldn't give it if he wasn't confident that you knew what you were doing. And you would be able to initiate all the treatment that was necessary for that patient before you called in and contacted. You didn't completely abandon radio transmissions to your supervisors at the medical center, but you were allowed to do it untethered initially, and that makes a huge amount of difference in the treatment of a patient in cardiac arrest, because time is of the essence in those cases. And if you've got to stop and wait to administer drugs or even an IV, and certainly intubate, and if you have to wait for all that for permission from somebody on a radio channel, this is precious seconds lost, and each one of those will definitely bring the likelihood of survival of that patient down. And so his procedures in that regard are largely what's turned the whole thing around in terms of seeing patients that would literally be able to walk out of the hospital after a cardiac arrest. Now, with that said, the direction that the fire department had prior to that for EMS since 1971 until Dr. Pepe's arrival later on in the 80s, it was absolutely a watershed change from what had been before. So these were, each one had its merits, and it just, in the history of EMS, we are obviously right now, and have been for a number of years, where we should be, but it was an evolution process.